How is a bone fracture medically defined? Imagine a bone that suddenly gives way under pressure or force. That's what a fracture is. It means the bone's structure has been broken or cracked. When you hear about a fracture, think of it as a partial or complete break in the bone's continuity. It can be as small as a tiny crack or as serious as the bone splitting into multiple pieces. Fractures happen when the force applied exceeds what the bone can handle. This can occur from falls, car accidents, sports injuries, or even from diseases that weaken bones like osteoporosis or bone cancer. Orthopedic surgeons look at fractures closely to decide how to treat them. They classify fractures based on a few key features. First, whether the fracture is open or closed. An open fracture means the broken bone has pierced through the skin, creating an open wound. This type needs quick treatment to prevent infection. A closed fracture means the skin stays intact, even if the bone is broken underneath. Next, they consider if the fracture is displaced or non-displaced. Displaced fractures happen when the broken pieces of bone shift out of their normal position. These often need surgical correction to realign the bones. Non-displaced fractures stay in their proper place, even if they are cracked or broken. They also look at whether the fracture is complete or incomplete. Complete fractures split the bone all the way through. Incomplete fractures, like greenstick fractures common in children, only crack partway through the bone. The pattern of the fracture is another important factor. For example, a transverse fracture runs straight across the bone, while an oblique fracture is angled. Spiral fractures twist around the bone, often from twisting injuries. Comminuted fractures are shattered into 3 or more pieces, usually from high-impact trauma. Segmental fractures involve multiple breaks creating separate segments within one bone. To diagnose a fracture, doctors perform a physical exam and take X-ray images. Sometimes, they use CT scans or MRI if the fracture involves joints or is complex. Treatment aims to control pain, realign the bone if needed, and keep it immobilized so it can heal properly. Methods include casting, splinting, or surgical procedures with plates, screws, or rods. The goal is to restore the bone's strength and function as quickly as possible. In simple terms, a fracture is a break in the bone caused by excessive force or weakened bones. It's classified by whether it's open or closed, displaced or not, complete or incomplete, and by its pattern. Orthopedic surgeons carefully evaluate these factors to decide the best way to treat each case and help the bone heal correctly.